We understand that it is a far more complex disease than we had initially thought. But unfortunately, there's still a lot we don't understand about this disease.
Dr. Jha, one of the things that we've noticed is that our understanding of the disease itself, the virus, has grown over a period of time. When it all started happening, everyone thought this was just a respiratory tract infection, upper respiratory tract infection initially. And over a period of time, there has actually been literature that suggests that COVID could actually be closer to an autoimmune disorder given the kind of reactions that it causes in the human body than anything else. How well do you think we understand this disease? Do we know it well enough now?
Well, it's a very good question. The short answer is we know it much better than we did 8 months ago. And we understand that it is a far more complex disease than we had initially thought. But unfortunately, there's still a lot we don't understand about this disease. So one of the things that people should understand about COVID is, and I really can't think of any virus that has such a broad range of effects, from 20-30% of people having no symptoms at all ever, to many people having very mild symptoms, to some people getting very sick, to some people dying. Like, there just aren't that many conditions that have this broad range of impacts. So clearly it has something to do with people's host immunity. It has something to do with a host of other factors, maybe how much virus you were infected with. But the bottom line is we are still sorting all this out. So there's a lot in this. So again, actually, let me make two more quick points. One is the way I think about this disease, and you really heard this from Dr. Galeria, is that there are two phases of the disease. There's the viremic phase, and then there's the immunologic phase. In the early phase, it acts and functions much more like a normal virus. In the second half, there's this very profound immunologic response that almost makes it look like an autoimmune disease that is triggering. It triggers that in some people, but not others. We've got to sort all of that stuff out. I would say we've made progress, but there's a lot that we don't know about this disease.